All right, let's get right into it. We're talking about an infection that is so aggressive, it's pretty much the stuff of medical nightmares. It's called gas gangrene, and it is a terrifyingly fast attacker that can take what seems like a simple injury and turn it into an absolute life-threatening crisis.
And that's really the big question we're digging into, isn't it? How is the tables turned so incredibly fast? The clock starts ticking the second that injury happens, and the body has a less than 2 days before this thing can become fatal. So let's start the investigation.
So first up, let's look at the very beginning, the onset. The first signs of gas gangrene, well, they're not subtle at all. This is not some kind of slow burn. It's an explosion. The change from a person with a wound to someone who is critically ill happens with this shocking, absolutely terrifying speed.
Now, what you're seeing here are the classic clinical signs. We are not talking about the normal pain you'd expect after an injury. This is sudden. It's off the charts, excruciating pain. The wound itself starts weeping this thin, really foul-smelling discharge, and the whole area just swells up, becoming hard and almost bronze-colored. But the creepiest sign? That's what's called crepitus. It's this crackling feeling under the skin. It's literally caused by gas bubbles being produced by the bacteria inside the tissue.
So you have to wonder what kind of microscopic monster is capable of this level of just sheer destruction. Well, the answer isn't some new exotic virus. It's an ancient killer that's been hiding in plain sight, literally right under our feet. Meet our prime suspects, Clostridium perfringens. And this thing is everywhere, in the soil, in dust. It even lives pretty harmlessly inside our own guts. In about 60% of gas gangrene cases, this is our culprit. It's not, inherently evil or anything. It's just an opportunist, waiting for the absolute perfect moment to strike.
And this table really shows you exactly why it's so dangerous. See that special feature? It's spore-bearing, which means it can basically just chill out in a dormant state for ages. And it's super resilient. But the most critical part, the real key to this whole thing, is its oxygen need. It's an obligate anaerobe. That's just a fancy way of saying that oxygen is literally poison to it. It can only come to life where there is no air.
And that leads us to its golden opportunity. A simple paper cut or a shallow scrape just won't cut it. C. perfringens needs a deep, messy, crushed wound, the kind you might get in a really bad car accident or a major trauma. This kind of injury obliterates blood vessels, and that cuts off the oxygen supply to the tissue. And right there, in that dark, oxygen-starved battlefield, its dormant spores wake up. They're ready to go.
So once it's awake, how does it actually attack? Well, this bacterium doesn't just multiply. No, it wages all-out chemical warfare. It unleashes this devastating arsenal of toxins that are designed to systematically dismantle the human body. The attack plays out in these 4 stages. First, you've got contamination. The spores get into that deep wound. Second, germination. The lack of oxygen is the trigger that turns them into active bacteria. Third, they just multiply like crazy in that dead tissue. And then finally, the 4th and most destructive step, they release their toxins. Let's meet the 2 main weapons in its arsenal. Think of the alpha toxin as the demolition crew. It's the main weapon, and its only job is to just tear everything down. It shreds cell membranes, and even worse, it blocks up blood vessels, which cuts off even more oxygen and creates more territory for the infection to conquer. Then you have its partner, the theta toxin. Think of this one as the saboteur. It causes massive vasodilation, which means the blood vessels get really wide, and that makes the person's blood pressure just plummet. And the effect of that alpha toxin is systemic and absolutely terrifying. I mean, this is no longer just a local wound infection. The toxin gets into the bloodstream and directly attacks the heart muscle itself, making it weaker and weaker, unable to pump properly. This leads to what's called profound hypotension, dangerously low blood pressure, which sends the patient spiraling into shock. Okay, so back in the lab, our medical detectives are racing against the clock to confirm what they suspect. And what they see under the microscope is both crystal clear and, honestly, deeply unsettling. So, what's the forensic report say? Well, first, they see the culprits, these thick, boxcar-shaped bacteria. But then they notice something really, really weird. There are almost no neutrophils. The frontline soldiers of our immune system, our white blood cells. They're just gone from the infected tissue. They should be swarming the place, but the battlefield is empty.
And that is the most crucial clue of all. The fact that there's no immune response is actually proof of how vicious this attack is. It means that bacterial toxins are so powerful, they're not just destroying tissue, they are actively killing off the body's own defense force before it can even put up a fight. It's a slaughter on a microscopic scale. So, with the enemy identified and its strategy exposed, there is absolutely no time to waste. The counteroffensive has to be swift, it has to be aggressive, and it has to hit from multiple angles at once. And the stakes? They could not be higher. Without immediate, aggressive treatment, the mortality rate for gas gangrene is a staggering 50%. It is a true coin toss for survival. So, how do you fight an enemy that can only live in the dark? Well, you flip on the lights. The treatment is a three-pronged attack. First, and this is the most important one, aggressive surgery. Second, a powerful cocktail of high-dose antibiotics. And third, a very specialized treatment called hyperbaric oxygen therapy. And let's be perfectly clear about this. Antibiotics by themselves will not win this war. The single most important part of this whole treatment is the surgery. Surgeons have to go in and physically cut out every last bit of dead, oxygen-starved tissue. Why? Because by removing it, they are destroying the anaerobic environment, the very home that the bacteria needs to survive. And all of this brings us to a final, pretty sobering thought. Clostridium perfringens, it's not some new threat. It's an ancient organism that's been in the soil for millennia. And it's a stark reminder that even with all our modern medicine, some of the deadliest killers out there aren't new creations. They're ancient opportunists, just patiently waiting in the dirt for their moment to strike.